I don't know how to thank you folks, actually, tell you the truth, frankly. This chapter cannot be better, cannot be much better, cannot be ever better more without folks like you. And all I can do is say thank you. It is the largest chapter in the country in terms of membership, in terms of the stuff that we do. So guess what happened? National decided to change the way they give out awards to chapters and said a chapter who wins the award in 1 year cannot apply for the same award the next year. Oh, this happened last year, so our names would have been there again and again and again. I'm not going to repeat that, but that's what we really did. We changed healthcare. We changed the way even awards are distributed at HIMSS. And again, that's not because of us. That's because of you. The last line there, we're going to talk about advocacy in a minute. I think Ian's going to come down and spend a few minutes here. And, you know, a couple of years ago, I think we did a joint conversational dialogue about advocacy, and we left the room thinking, man, we changed the way advocacy works in this place. We will try to do that again, if possible. This is something that we are really proud of. I have lived in about probably 4 or 5 other places in the United States, mostly in the Northeast and in the Midwest. But one of the things that I found was the diversity in the type of people we bring into this organization. We've, of course, got our HIT vendors, but it's the combination of vendors, providers, payers, physicians who are members, nurses who are here, informaticians who are here. The diversity of people we bring to these discussions is probably far more than what I have ever seen in other chapters. That's not because we are a large chapter, but I think it's because we strive, we struggle, we try to get you programs that will meet each of your needs, and that's what we've been looking at trying to get done. So to talk about where Southern California is and what we are doing, I'll just share with you just a couple of slides, just 2 slides, and that'll give you the picture. This is our stats from March 2016. Tweets, social media, and stuff. So this is not something that we are doing as a chapter. This is something that you folks are helping us move forward. The number of tweets we got, the tweet impressions we got across all of our events. And I can tell you, the CRO event we had in December last year was fantastic. Sold out. There are guys calling me from Northern California and asking me, could you please get me a seat inside? Because I know you're the president and you have the means to do it. And I said, no. Because that's the way we are. We had a sold out crowd for the CIO forum. We probably have a sold-out crowd here as well. And we're doing a joint forum in LA on privacy and security. Guess what? Privacy and security, and when I mention the word ransomware, everybody stands up and runs, right? So we're doing something there with National. HIMSS Media, National HIMSS Media is working with us to actually put up the event together in LA, because they feel that one of the key things that they can do with partnering with us is to help their presence grow as well. So that's a new, unique thing we've done this year. This is the top tweets, and you can look at that. We're already getting tweets on the clinical informatics event. We got the, how about a patient participant roundtable? There's a question there. This is coming from our membership. This is not us. This is just from our membership, asking us to do more and more and more. So what we try to do, and we try to figure out how to make this work, is we have a schedule of programs that we put together at the beginning of the year. And in many instances, you know, we have, what, 4 or 5 programs which we do. HIT Day, our forum, this event, the privacy security event. And every time when we do something like this, we get more. Why can't you try doing this? We're probably looking at doing a patient engagement event. We got Clark here who come from Scripps, and he's a fantastic person who's put together a patient engagement panel. It's just great. So there are things that we do for voluntarily for you folks. So we want to make sure we are addressing your needs. So if you have any requests, anything you would like for us to do, let us know. We'll make our best efforts to get you what you want. Because one of the things that we do is we strive for our membership, and that's what we've been doing all the time. The best part is our sponsors, right? There are a lot of companies here who sponsor events here or become sponsors of us. We got, what, 3, 4 kind of criteria for sponsorship. See, sponsors really want to sponsor the event because they know that they will get folks like you in here who can also talk to them. So please make sure when you walk out, spend some time with the sponsor so they understand that you are here and they are here for you, okay? Predicting the next wave of healthcare, balancing the hope of moonshots with pragmatism, the last line. And this is stuff that we can figure out, we can do. But is this something that you want us to do? How do you want us to do this? What are the things that you want to get engaged in? The other thing that I also want to highlight is we have an excellent team of volunteers who are members of the board, members of committees, all along the way, trying to help put this event together and get stuff done. But we can of course get more volunteers to do this. We have in some chapters, they've had a situation where a president became a president, became a president, and became a president for 4 continuous years. In our chapter, we have people lining up behind me to become presidents. That's true differentiation factor because we've got a lot more volunteers helping us, and we need a lot more volunteers to help us as well. So let us figure out what we can do, and if you can help us, join with us, help us make it all worthwhile for all of us together. That's what I think is going to help us move forward. Now, looking at changes in healthcare IT and everything else that's going on, there's probably a lot more that we can talk about, and I'm not going to take your time doing that. I'm going to ask Ian to come up and say a few things about advocacy because he's the guy who's our new bright kid in the block. You know what he did? He became the region chair for regions, meaning the entire Western region chair for advocacy last year. Ian?
Thanks, Sri. I became the region chair because no one wanted to take it, so it wasn't much of a competition. Just want to give a quick update regarding advocacy and public policy. I only have 5 minutes, so the slide's not going to change. Just want to get a quick pulse on who we have in the room. How many physicians do we have? Any physicians? All right. How many informatics folks? Nursing informatics, clinical informatics? Great. Any vendors, EHR, EMR, related vendors? Okay, cool. And management, administration for hospitals. All right, cool. And the reason I wanted to do that is one of the things that we're working on heavily, both on the national front and here on a state level, is MACRA. I don't know if you guys have been reading about that. That's the Medicare Access and CHIP, Reauthorization Act, and CHIP is the Children's Health Insurance Program. So that replaced the SGR, the Sustainable Growth Rate Formula, as of last year. Now, the reason I want to bring this to your attention is because this legislation is the start to move healthcare from fee-for-service towards value-based payment. Now, there are 2 very important things that is embedded in here. One is 2 pathways, which is the merit-based incentive payment system, and the other one is the alternative payment model. Now, what's in it for you? So if you're a physician, one thing I strongly advise for you is to start looking at what's going on with this legislation. There are a lot of things that we still haven't fleshed out. There are a lot of work groups going on to talk about what are the things that we can do in terms of implementing it. And you really want to look at those two pathways because one of them includes a penalty, the other one includes bundled payments. So that's very important as you're looking into the next 3 to 5 years to see where you want to go with that. Now, if you're in clinical informatics and nursing informatics, or you're just new in healthcare and you're trying to figure out where would I go in terms of next wave in healthcare, as one of the tweets said, I would highly recommend, because of what's going on in the public policy sector, to really look at data analytics, really look at how you process data into information and make it actionable. So predictive analytics is going to be a big thing. Now, if you are hospital administration, one of the things that you want to start thinking about is because we're moving, well, payments are moving from fee-for-service to the value-based, you want to look at what are we doing to intervene in the patient's wellness continuum more towards the health and preventive care and obviously continuing with the curative. But the more we keep them on the preventive side, the better we're going to be aligned with this MACRA law. And last but not the least, for the vendors, I know that everyone just finished working on the meaningful use certification process, painful ordeal. Well, guess what? HIMSS is actually gonna include a new certification process that we have to start looking at, and that rolls in PQRS, the Physician Quality Reporting System, that rolls in meaningful use, that rolls in the clinical practice information activities. Now, all of these things haven't been flushed out just yet, but we're gonna need to go through that process again. And the whole goal is to move from fee-for-service to value-based payment. Now, a lot of these things haven't been fleshed out, as I've said, so where you can come into play is provide comments, okay? So that's what HIMSS has been doing. We've been providing comments to the ONC, HHS, letting them know what we think from our side. So we have a booth outside, the advocacy booth. If you want to hear more about this, I'm going to be there. We have brochures, how you can sign up, how you can be active in this, and at a bare minimum, keep you up to date with the policies that will be affecting you in the near future. So hopefully that was helpful. Thank you very much.